Welcome to VYAPT Growth Series, a platform to showcase growth opportunities for various businesses and sectors. In this world of rapid growth, we bring meaningful insights to feed your hunger for knowledge. While doing this, we contribute in making this world more connected, where we understand what shapes our lives. The real heroes are the leaders who share their experience and strategy and involve in meaningful conversation. Our belief and commitment towards global growth grows stronger as we welcome Mr. Narendra Varde, MD at Roche Diagnostics India and Neighbouring Markets, in our growth series today. Hi Narendra, nice to have you in our series.
Hi Pankaj, thank you for the invitation and pleasure to be here.
So we start with our questions and curiosity, Narendra, and you have been a very special guest for all of us, and the entire world would like to know, more about the diagnostic space. So can you talk about innovation in diagnostic space and Roche's contribution in Indian diagnostic market?
Sure, Pankaj. So, firstly, a warm welcome to everyone. Uh, Great to be on this platform of VYAPT Growth Series. Talking about innovation, I represent Roche Diagnostics, and Roche as a company is a strong believer in innovation. We are one of the strongest contributors to R&D globally. We invest around $12.2 billion in R&D annually, and that's huge. So in healthcare, we are number one, and across industries, we are among the in the top 10. And innovation is very important, especially in the field of healthcare. Earlier when people would have a heart problem and the way they would be treated with the open heart surgery to where today things are done in a minimally invasive way. It's all happened through kind of different innovations that different companies have brought in this industry. One thing which I'm very clear of is all this innovation that's been done globally. I want to make sure people of India benefit from it, right? My fellow citizens benefit from it. And that's where our strategy is very clear. When innovation is launched globally, we also want to launch it in India, make it accessible, find ways to make it affordable, and make sure the best kind of diagnosis is available in the India market. Speaking about innovation, I think everyone will relate to this, that how important the whole RT-PCR test was for COVID diagnosis, and Roche was the first company that came up with the COVID RT-PCR test. So again, that's a testament to our pride in our innovation, that we were able to in the thick of the pandemic bring in the world's first RT-PCR test. And this is where I think the innovation mindset is so important, and innovation is not just in terms of products, but also in terms of how we do things. We've contributed to India specifically in a significant way. We run one of the largest public-private partnerships for the government of India, for NACO, for the National AIDS Control Organization, where we screen for HIV screening. We also are part of multiple hepatitis programs, into cancer diagnostics, into blood safety, because blood is not a luxury; it's a basic need for everyone, and ensuring people get safe blood. So NAT tested blood is something again that we focus on. So a lot of the major hospitals and labs in the country, right from AIMS to CMC Vellore, and the big names, we are suppliers to these all of these reputed companies and names, and that makes me very proud, because we are able to serve the people in the country with the best quality products and innovation that we have, Pankaj.
So in a nutshell, you support the lifeline of the country.
Yes, absolutely.
So that does make sense to me. But can you also talk about when you just said that in this diagnostic space you are helping the country and the fellow citizens with the let's say diagnostic space in cancer or in AIDS and other things. Obviously, these things are benefiting the lives of people in a great way. But what are the growth prospects of this industry in terms of opportunities of Gen Z, and how are you making these things sustainable for future?
Sure. So, Pankaj, if you see, this industry is still very underpenetrated. Actually, COVID helped diagnostics to get some importance and some awareness amongst people. Otherwise, I would personally be struggling with this when I would explain people that, I had diagnostics. People only in healthcare knew pharma, right? No pharma, no drugs. But I think diagnostics is the first step. If you detect early, you can prevent things early, right? And we know this across different areas. In cancer itself, if you're able to detect and diagnose it early or even before it happens, great position to still live a good quality life rather than when it is in stage 4 or later and then it is just palliative. Diagnostics was very poor. I'm very sure if you can poll and ask people pre-COVID, how many people knew what is an RT-PCR test? Um, I'm sure the percentage would be in single digit, right? And now, if
True.
you ask people, it would be probably close to 100% that people would know what an RT-PCR test is. So I think it starts from there. From a growth, I can say that this is now the era of diagnostics because more and more people are now understanding that if you are able to detect early what's going wrong, then you save a lot of challenges going forward. I'll give you a simple example. India accounts for 25% of the world's mortality in cervical cancer. Now, that's huge if you think of it, right? One in four women who die from cervical cancer are from India. We actually have a test called HPV test. Again, it's an RT-PCR test by which women can take this test and they would know if they would be at a future risk of developing cervical cancer. I mean, isn't that great? Like, if you can get yourself tested and know that, yes, you would be at a risk of cervical cancer, you can actually prevent all that trauma, that torture, not just to yourself, but also to your family, the expenses, the burden on healthcare, the poor quality of life you would lead. If you get cervical cancer and that too at a late stage, you can really prevent all of these things if you test early,
Mhm.
right? So this is just one example to share that how people need to get more aware, and that's where the whole growth in this industry comes, right? People
Mhm.
need to get themselves tested for their routine tests because those parameters would get you to know if something is off and do you need further intervention. Today, more than 70% of decisions by clinicians are taken based on your diagnostics test. And the reason I'm saying all this is because if you look at our expenditure on diagnostics, it's only 2%, right? Only 2% of the overall healthcare expenditure. But
Mhm.
we keep saying prevention is better than cure. We also kind of need to put it into practice.
Mhm.
Um, and once this happens, I think this market is just going to open up. And there are so many other new things that are coming in, especially for people, the next generation who wants to kind of make their careers and are looking at different careers. Sequencing, genomics, again, is such an upcoming field. We are, for instance, going to launch a product by which you get a complete mutation profile, a comprehensive genomic profiling that can be done. So there are multiple different areas where people actually can look at it from a growth standpoint. And again, diagnostics being so underpenetrated today, that space is just going to grow further. It's also a very unregulated market today, so I'm also expecting as we move forward, more regulations will come, more stricter accreditation will come in place, which will just take up the requirement for quality further up, and we'll be able to provide really high quality diagnosis across the country.
That's really great, Narendra, and this gives me a platform to ask the next question. So it's basically a sub question of what you just said. So you mentioned that Roche is into diagnostic space, but you also mentioned about certain kind of a probability. And if I have to, talk in my words, it is predicting future and taking precautionary steps. So what you're doing is you are not only ascertaining the present of a person, but you are also ensuring that the future remains, healthy for that particular person, and hence the technology. And you talked about the R&D, expenditure which you are doing and the innovation which you are putting in. But can you also talk about, how are you awareing people around it? Because you just talked around certain numbers, which is still which is very alarming. But when you talk about the general public talks about something which happens. Okay, so let me go and find out what has happened. But not much of diagnostic has taken into. You rightly mentioned only 2%. But you know talking about the future and the probability around it, don't you think it's, even today, it's a mundane task for people, but it's very, very far away from the reality which we are facing nowadays?
No, I absolutely agree, Pankaj, and that's where we also face a challenge because we are not able to, being healthcare, there are certain regulations in terms of how much we can communicate and how much we can talk about things without it coming across as promotional. So we do a lot of education related activities, especially with the different hospitals, labs, to whom we provide our instruments, our reagents. That's where we actually give them the material to educate patients more. Our main job is mostly in terms of skill set upgradation or creating awareness on novel markers, on high value markers with clinicians, with the labs, with the technicians, and really upgrading the skills of the healthcare fraternity, if I may say, in the space of diagnostics, right? And how diagnostics can become an able partner to aid diagnosis better. Um, what we also do is we do run campaigns. For instance, when it was the cervical cancer month, at that point in time, we did have a lot of awareness talks. We did have a lot of advocacy that activities that we did. Now I don't know how much the general public actually reads or goes through it because it's not really part of mainstream media. But we do try in our own way through sometimes even Facebook lives and other online platforms to create some of this awareness. I think a lot of these patient groups also play an important role. Like the thalassemic group is patient advocacy group is very active. They partner with us in even speaking with different state governments, central government, in terms of how important safe blood is, how we should, how testing for NAT is important, so that infections are not transmitted when someone is donating blood. So I think patient advocacy groups also support in a big way in creating that advocacy, and actually like it better coming from them, because sometimes when we say it, it always comes at what's the intent. Is the intent really promotion? Is the intent commercial? So even if you want to do good and you really want to showcase that yes, these are the different solutions available that the general public can really benefit out of. We do not go aggressively in promoting it. We prefer that the healthcare practitioners and patient advocacy groups speak for it.
So Narendra, what you're doing is you are actually helping in nation building uh, by ensuring that the capability is built for diagnostic labs, so that they
Yes.
can do it a little more better the next time. That makes a lot of sense for me, and thank you for sharing these insights with us. And this allows us to go for the next round, which is called a rapid fire round.
Okay.
So in this round, we'll have 10 questions, and these 10 questions you have to answer in one word. For every question, you can take not more than 1 second or two, maybe.
Okay.
Okay, so here we go. The first one: coffee or tea?
Tea. Indian
Okay,
masala tea.
that was specific. Okay, what childish do you still enjoy? So any childish thing which you are doing even nowadays, which you enjoy doing?
Childish thing. I think I was very fond of reading maps when I was a child, and I still kind of enjoy reading maps in my spare time.
Oh, I think that's one of the ways how do you navigate the market as well.
Probably.
What's your favorite book?
uh, Never Eat Alone by Keith Ferrazzi.
Okay. What's your favorite childhood memory?
Sitting on a double-decker bus in Mumbai on the front seat. Great views, great wind. I think that's what I really remember about Mumbai.
Great one. So, what's your favorite color?
Blue.
Okay. What's something you do but you don't like doing it?
Household chores,
Okay.
specifically ironing clothes. Just can't do it.
Okay. So, what's your favorite food?
Biryani.
Oh, that's the number one selling item also on Zomato and Swiggy.
Yeah, I may be contributing to it.
You are. What's a hobby which is closer to your heart?
I love to travel. Love to travel. Love to gain new experiences.
Okay. Your favorite dessert?
Anything which has salted caramel in it.
Okay. So you love caramel. Okay. Your 3 a.m. meal.
3 a.m. meal. I don't really have anything like a 3 a.m. meal. Yeah, not that 3 a.m. waking up person and eating person.
So you answered 9 out of 10 questions.
Yeah,
So
answer
that
the 10th one also, but
no,
it's
you did
it's just
not.
that I don't do a 3 a.m. meal.
Um, so what's your 3 a.m. meal? I mean, favorite one. So if you have not, tried till now, next time try it. If you are on a journey or doing something,
Yeah, I
probably
think
try
I
it
think
out.
I'll do Maggie noodles because that's the easiest. 2 minutes at 3 a.m.
Fair enough. Taken this. Good performance in rapid fire round, Narendra, and we'll come up to the last question of this episode now, and that has to do about you in person.
Okay.
Narendra, businesses contribute in their own way, and so are the leaders. But the world looks at the leaders like anything. You talk of any business, and people love to see a leader which is inspirational. I love to see a leader who is purposeful about not only the kind of the things organization is doing, but the way he serves the purpose in life and other worlds. So, what's your purpose of life, and something which you'd like to share from your journey?
In terms of purpose, I would say what really drives or motivates me is creating impact and creating value. And whenever there is any decision or any role for that matter, which I even decided to take up over the years, it was always in terms of how challenging it is, how can
Mhm.
I contribute to it, and what impact can I bring in. If something tends to be the same thing you're doing day in day out, and doesn't bring in its own fare of challenges or own fare of new ways of doing things or new ways of thinking, then that just doesn't go well with me. So say creating that impact and value through challenging activities really drives and motivates me. um, yeah.
So, Narendra, we have one question which is coming up from our viewers is what drives you, what is core, in you, which drives you to become to a level of what you are, that's it's coming from Facebook. So can you help me understand, can you be a little elaborative on that part? You just talked about your what drives you, but a little more elaborative so that people who aspire to become like you can get a little more insight around it.
Sure. So I think it connects well with what I just mentioned. What I try to always do is I I tried I tried somewhere also not to follow, a specific path, right? I did my engineering. I was kind of a merit rank holder in engineering, but I went into project management and microfinance, and then I went for an international MBA. And the one thing which I did, which worked for me, is um, I accepted different kinds of challenges. And even if those challenges seemed very tough,
Mhm.
I took them on and I kind of gave it my 100% to see how I can, be the best version of myself and how I
Mhm.
can really contribute and deliver on what the expectations were. For instance, at a very young age, I got this responsibility, and that too because there was a vacancy in the position of the person I was reporting to. So I went into a role, and that month itself, my boss left. So the um, whole responsibility came onto my shoulders, and I was in Singapore. Managing a lot of work in Asia Pacific. And Japan, for instance, was one of our largest countries. And Japan uh, tends to be and used to be a lot more hierarchical that time. Even age mattered a lot, and it came with its own fair of challenges in terms of what is this kid going to come from Singapore and teach us, or what is he going to question us. And those moments can be quite demotivating when people are questioning your caliber or your judgment, or that they're judging you not by your potential but just by your age. And it can be demotivating, and you can go into a shell, or you can try and avoid the problem and say that, okay, I will not address Japan, but I'll try and support the other countries more. Or you can take it head on, and you can take it as a challenge, and show the country head that you can really add value and contribute. And I think I prefer doing the second part of it, which was very challenging. But I think if you are true and genuine in what you want to do, in what you want to contribute, if you are hearing the other person's needs, problems clearly, and then coming and trying to find a solution and supporting, I think people appreciate it, right? Because at the end, it comes back to what I said before. It is about what impact and value you are able to drive. So that 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 experience helped me, and that helped me really to say that yes, if there is a challenge, take it head on, try and genuinely let's try to figure out how to address it, and take it on. And so whenever opportunities came up, I worked across 6 different countries, in a span of like 10 to 12 years. And it meant a lot of change. It meant every time change of location, change of team, change of environment, change of food, change of boss. Every time you have to change, you have to adapt yourself. You have to build credibility again with your new team in the organization. And all this was within the same organization. So I kept moving roles within the organization. But still, it was everything new when you move from Singapore to London, or from London to Switzerland, or any of these assignments. And I think if your mindset, if you keep a positive mindset, right, and you try to figure out that yes, it's a challenge, but you have to solve it, and there are always multiple options to solve a problem. And if A doesn't work out, you go to B, and if B doesn't work out, you go to C. I think it works out, and people appreciate that kind of, I think, grit and resilience. So yeah, Pankaj, I think probably this is a specific example that I wanted to share about one instance of my journey.
That's really nice, Narendra. So you just talked around that you are agile enough to embrace change, and that's one mantra which has probably given you the kind of success you are tasting today. But obviously, it also requires a lot of hard work, which you must have done along the way, paving
Absolutely.
your path towards success. Thank
There's
you
no
for
shortcut to it.
yeah, and there's no shortcut to it. Very, very true. Thank you for enlightening us with insights and knowledge, and most of all, your thought leadership. Thank you for being part of VYAPT Growth Series, Narendra.
Thank you, Pankaj. Really enjoyed this conversation, and love the questions because they were different in terms of growth, and I think this is the first time on such a forum I've had like a rapid fire, so that was fun.
Thank you. So we'll come up with another episode of VYAPT Growth Series. Till then, think growth, think VYAPT.